Good morning, everyone. My name is Maya Tate, and I am the Mayor of the District of Sooke and your MC for today's event. Before we begin, I do wish to acknowledge that we are meeting on the territory of the Sooke Nation, and we together are respecting their history, customs, and culture. Thank you very much for hosting us on your lands. I just wish there is a technical housekeeping detail in that because we're all standing 6 feet apart, the speakers will be removing their masks when we're speaking. So let's take a moment to welcome our guest speakers. Very pleased to have our MLA, Premier John Horgan, with us, Dr. Robin Saunders, and Leighton Engweir. We're here today for a very important and exciting announcement that will transform how people in Sooke are accessing primary care services. But firstly, I wish to invite Dr. Robin Saunders, who is a physician at the clinic and has been a passionate advocate for transformation in family medicine, as well as a valued member of our community since 1982. Welcome, Dr. Saunders.
Thank you. So thank you, Mayor Tate. So I'm speaking to you today wearing multiple different hats. I'm the immediate past chair of the South Island Division of Family Practice, and I'm co-chair now of the Partners for Better Health and co-chair of the steering committee for our developing Western Communities primary care network. More importantly, I'm speaking to you as a family physician who has practiced in Sooke since the late 1990s. Actually, it's 29 years since I've been starting practice here. And the thousands of patients in Sooke and the surrounding area that regard this building as their primary care home. The development of a multidisciplinary care clinic in Sooke has long been a dream of mine and many before me. Now, with the help of our provincial government, strong collaboration with Vancouver Island Health Authority, and the unwavering support of Sooke Council and the staff of the Division of Family Practice, it is finally becoming a reality. Very soon, care will be provided using a multidisciplinary approach that will better serve the needs of our diverse population. Our healthcare team has for many years included a primary care nurse, a dietitian, and a social worker. We are planning on expanding that team to include an additional 2 nurses, a nurse practitioner, and hopefully at least 2 more family physicians. By maximizing the full potential of these providers, we hope to be able to attract many more patients from the community so they can also regard this clinic as their primary care home, providing full longitudinal care for all ages. There does, of course, remain a considerable amount of work to be done to achieve this objective. The current working trust, though, developed between the Health Authority and this clinic, will hopefully enable us to navigate these next steps with consummate ease. Completion of the medical clinic expansion is an amazing first step. The fact that it was built during a COVID-19 pandemic is not only a testament to the work ethic of the planners and the builders, but also the professionalism of everyone who's continued to provide services under extremely difficult circumstances. I would like, first of all, to especially mention our truly amazing medical office assistants, led by Robin Stewart, and my colleagues, Dr. Chilton, Forsberg, Hurling, Klug, Valley, and Van Breda, who have shown remarkable resilience during some medically challenging times. Their compassion, medical acumen, humor, and willingness to continue to provide services, often at personal risk to themselves, is truly remarkable. But none of this would have been possible without the drive and irrepressible determination and energy of Dr. Anton Rabin, who has unwittingly taken on the mantle of clinic director and clinic partner. I'm not certain that he knew what he was getting into. Lastly, but not least, thank you, Premier Horgan, for being our MLA and for always being available to listen to our ideas and ideals, not only on healthcare reform, but also our wider concerns with respect to the social determinants of health affecting Sooke residents and the local environment. We may not always agree on the best course of action moving forward, but we know that you have considered our viewpoints carefully and that you will always act in the best interest of the community as a whole. Sooke is a small community with a very big heart. We look after one another. We regard you as being truly part of this community, and we appreciate everything that you have done for us, undoubtedly will continue to do in the future. Thank you so much.
Thank you so much, Dr. Saunders. I know that you and your entire team have worked continuously to promote and strengthen healthcare services here for the people in Sooke. Our next speaker this morning is Leighton Engwer, who has served as a patient care partner for the past several years. And today, he'll share more about today's announcement and what that means to people and families within our community. Welcome.
Oops. Good morning. You know, I'm only one of several residents in the community that had a part in making contributions to the opening of this clinic. I don't know if you know, but this clinic is somewhat unique across the province in that it is a working relationship between Island Health and the people within this clinic. Now, what that does is improve the ability to provide integrated care for the residents of the Sooke region. So with this expansion, we've also achieved an expansion in physician capability and capacity to increase the attachment, to improve the ability for residents to get the service they need locally. So this physical expansion is much more because it's going to service the residents of the community. The other thing I'd like to mention is this is my clinic as well. And over the past couple of months, I've had cause to seek care here. And I've just been so impressed that what this clinic has done to accommodate the residents in Sooke during this pandemic. So I want to thank the people of this clinic for that service. So we got to congratulate ourselves for that. We got to congratulate ourselves for the capacity growth that we can have here and congratulate the clinic for this opening. So this is good news for the residents of the Sooke region.
Thank you so much, Leighton. We're very excited about what this will bring to our community. And our final speaker today is none other than BC's Premier John Horgan, our MLA, who has some exciting news for Sooke and the surrounding communities. Welcome, Premier.
Thanks very much, Maya, Dr. Saunders, Leighton, and the entire crew here at West Coast Family Medical Center. I am absolutely delighted to be here today to participate in the expansion of this clinic to add two new GPs, a nurse practitioner, 3 medical office assistants, and 2 nurses, 2 RNs to complete the complement of the staff here providing primary care to the people of Sooke. We are on the traditional territory of Sooke Nation, and the Sooke Nation will be an integral part of this as well, as the clinic will provide services for the elder wellness capacity within the Sooke Nation. And I think it really brings together the work that Dr. Saunders talked about that's been going on for decades here in Sooke. Robin didn't make reference to the many other physicians who have come through through Sooke over those decades that he's been here, offering their advice and counsel on how best to expand the delivery of healthcare services in this growing community on the west coast of Vancouver Island. But I want to mention one in particular, Dr. Ellen Anderson, who was the first person I met shortly after I was elected 15 years ago. She sat me down at the local coffee shop and explained to me why it was my fundamental obligation to make sure we expanded healthcare delivery in this community. She talked about the social determinants of health. She talked about food security. She talked about the challenges of living in a small community on the west coast of the island. And that had a profound impact on me. And for the past 15 years, I've been doing what I can to advance the ideals and the hopes and the aspirations of the clinicians here in Sooke. And I am so happy today to announce the expansion with the good work of the Vancouver Island Health Authority, my colleague, Minister Adrian Dix, who took to this issue as quickly as he possibly could upon our being sworn in as government. And although it's now 3 years since that happened, I think in that 3 years, we've had thoughtful participation, not just from the clinicians, not just from the infrastructure in the community, but the entire community has been focused on, as Robin said, a wellness place for the people of this area. And I'm so profoundly happy to have had a small role in that over the past number of years. Now, opening up a clinic like this in the middle of a pandemic, as Robin said, is quite extraordinary. So to the tradespeople and the craftsmen who came in to make the expansion happen under difficult circumstances, the patients that continued to get access to care here, it was just a seamless process. And I think part and parcel, as Maya would agree, Mayor Tate would agree, it's just part of who the people of Sooke are. There was a task to be accomplished. It was in the interest of everyone. Let's get at it. So with that, I'd like to say, I think we're declaring ourselves officially open. I know for the many people who have been working here for the past number of months, that's old news. But come Monday, there will be an official opening of the West Coast Family Medical Center, providing primary care to the greatest community that I have the pleasure to represent with Mayor Tate and others. And I'm pretty excited. I'm busting my buttons a little bit because of the pride I have. Dr. Forsberg, Anton, the whole team here have really worked tirelessly and with a level of dedication that I have not seen in any other corner of my time as Premier. So I'm very proud of the people here, and I'm extremely proud of the services that are going to be provided to the people of Sooke. So with that, I'll say thank you very much, and I'm passing it back to you. Or am I passing it to Jen? Back to you. Okay.
Thank you so very much, Premier. Truly, the newly expanded clinic will bring meaningful change to the lives of our residents, giving them better access to team-based care and to the healthcare services they need close to home. This brings us to the end of the formal part of today's announcement. I wish to again thank Premier Horgan for being here this morning, as well as all the speakers who took time. I wish to also thank all of those who have contributed to making this announcement a success, including Island Health, the West Coast Family Medical Clinic, the South Island Division of Family Practice, and members of the Sooke Region Primary Health Care Services Working Group, which I have chaired since 2014. A special, deep, heartfelt thank you to all the doctors, nurses, nurse practitioners, social workers, dietitians, medical office assistants, healthcare professionals, pharmacists, who are working so hard right now to help us live healthy lives, especially during these extraordinary, difficult times. Advocacy work regarding the development of our healthcare infrastructure, and specifically in support of increased space so that all residents have access to the care they require, has been ongoing in our region for more than a decade. Today's opening of the expansion and evolution of team-based care model brings us one step closer, and I'm so very proud of how far we have come. However, our work on this issue is not yet complete. Now we have another 10 years to look forward to ensure we build the capacity to meet our future and growing emerging health needs. And as you've heard, many people have come together to make this possible, and I'm looking forward to continuing these relationships. And again, a deep felt thank you to everyone involved. So I'm very moved by this. At this time, I'd like to invite our Premier back to the podium for a final Q&A. Thank you so much.
Thanks, Maya, and I think I speak for Robin when I say 10 years from now, we'll be happy to come visit. And Layton as well, for that matter. So I think Jen's going to ask for questions.
Yes, thank you. To the reporters on the line, please press *1 to get in the queue. If you've already pressed *1, please press it again to ensure you are in the queue and we do call your name. Our first question is from Rob Buffum.
Oh, hi, Premier. Thanks for taking my question. I guess my question is, what's your response to those people who say, you know, it's great to have these new resources, but they have concerns about not being attached to a specific GP because they don't have that continuity, particularly as they get older, let's say, so that there's one family physician who is their treating doctor and knows knows all about their health throughout the system. What's your response to that criticism?
Well, it's a legitimate concern. I wouldn't call it a criticism. We had a briefing prior to the announcement today with the medical team here, and we talked about the challenges of recruiting and retaining GPs, not just in British Columbia, not just in Canada, but indeed around the world. And we need to produce more docs, and we're looking at expanding spaces at UBC and other post-secondary institutions in British Columbia. But in the interim, putting in place primary care networks that can attach patients to the healthcare providers they need is the appropriate way forward. And I believe the model here at West Coast Family Medical Center is the ideal model, where you have GPs, you have nurse practitioners, RNs, and other healthcare providers that can provide that continuity of care. And I would also say that we're a good distance past great thick files, paper files on a person or an individual's health needs over a period of time. With technologies, that information can be transferred seamlessly with privacy concerns being protected from practitioner to practitioner. So I think the model of the past, if I could put it as the Leave It to Beaver model, is something that we have built a very respectful and proud tradition in Canada, but we need to move to a new way of delivering services, and I think this is the ideal location to start that out. And having urgent primary care centers in communities around British Columbia takes pressure off of emergency rooms and provides patients with comfort that they're getting a continuum of care that meets their needs in the long term. So do we need more docs? Absolutely. But in the interim, let's put in place solutions to the problems as we can, where we can, and that's what we're doing here in Sooke today.
Our next question is from Dawn Gibson from Sooke Newsmere.
Hi, can you hear me? Okay, perfect. So I'm wondering what kind of the immediate improvements that residents can expect from this expansion, and is it going to kind of balance out that need in comparison to what the population is here?
I believe so. I don't know if Robin wants to answer that, but I'll give it my effort, and then I'll perhaps ask Dr. Saunders to come up. But thousands of more patient visits will be able to take place because of the expansion, not just in physical space, but adding new service providers, whether they be RNs, nurse practitioner, or GPs. So it's going to provide more services to the community in the thousands of visits. And I think that will, again, begin to alleviate the growth in the community. Sooke is a fast-growing community. The docs here want to participate fully in the development of that. We're going to see more people coming, and this clinic will now be well-placed to meet those needs, not just today, but into the future. We've got a 10-year horizon, if I heard the mayor correctly, and so let's start today building for that 10-year future. Maybe Robin will answer that.
So thank you. Yes, this is the first step, but there are many more steps to come. We need to recruit these ancillary staff to this new space, and we need to form the teams that will enable us to wrap the team around the patient so that the patient gets the correct care from the right person at the right time. It's not going to be instantaneous, but we've already made steps to form those teams. We've already recruited some of the nurses. We already have in place a social worker, a dietitian, and an IHN nurse. And so at the end of the day, we will be increasing our capacity by enabling people to see, as I said, the right person at the right time in the right place.
Our next question is from Mary Brooke.
Hello, Premier. Good day for fishing out there, I presume.
Has the federal government announced allocations? I don't think it's a good day for fishing until DFO says so.
Okay. The West Coast Family Medical is privately owned, developed over the years by local doctors. So this is kind of a unique investment for the government in that the government, I presume, has paid for the expansion of the building. And so we'll look for a comment on that. And also, how long will the new salaries be funded by the government, or is that something to be taken over by the clinic in the future? Well, and also, is there one more thing, the X-ray clinic, has that been included?
Yeah, well, let me start at the back and work forward, Mary. The imaging issues are still unresolved. We spoke about that briefly, the docs and I, and we're going to continue to work with VHA and the provider here to see if we can integrate those services more effectively going forward. With respect to the private nature of this clinic, in my mind, that speaks to the commitment of the docs here in Sooke who were waiting patiently, Robin, for decades, for government to respond to the needs in the community, and not seeing that progress being made a decade ago, the docs banded together, put their capital in play, put their futures on the line to provide services to the community. And we've been able to take that initial step, add the public component to it to provide expansion of services. And I think that the model was one of necessity. At the commitment of the docs who put the clinic in place to begin with, and then waiting patiently for the provincial government and VHA to catch up with the needs in the community. I think that's a fair statement without throwing anybody under the bus. And VHA has been superlative in their efforts over the past number of years to make this expansion happen. And in terms of ongoing funding, the people of Sooke can count on the province and VHA providing those resources to deliver the services that the docs were doing tenaciously for decades before we got to this point of getting this model established today.
Our next question is from Sandy Hall at CFAX.
Hi, good morning, everyone. I'm just curious about the new positions being added to this clinic, and if they are new, are they replacement positions? And if so, how many are you still looking to add?
Well, I'll take a shot, and Robin can correct me if I miss, but this is my quiz for the day. 2 new GPs are added to the complement already here. That's net new 2. The one looking to be hired in August, or to begin in August, and the second one, recruitment is still underway. Nurse practitioner will be the first one in Sooke to be working out of this facility, and that recruitment is underway as well. 2 RNs are already in place, a third's coming. We need 3 more medical office assistants to add to the complement of extraordinarily capable people right behind me. And so I think we're looking at full complement by January. Certainly, I got a grimace on that one. We're hopeful that we can do this recruitment as quickly as possible. There's a scarcity of professionals. We've already discussed that in previous questions. So we have to make sure that we're recruiting the best possible candidates. Obviously, Sooke is a desirable place to come and live and practice, whether it be as a GP or a dietitian or social worker or an RN or a nurse practitioner. So there's a lot to commend Sooke to those professionals, and I know the team here is going to be very persuasive, and Mayor Tate will be rolling out the welcome wagon as well. And I think that maybe my optimism is not shared by Dr. Saunders, but I know if I were looking for a place to hang a shingle, I'd be wanting to do it right here.
Next, we have a question from April Lawrence from Czech.
Do you want to fill that in? Okay.
Oh, hi, Premier. Thank you. And sorry, I just want to switch topics for a moment here. With growing calls for a comprehensive review of policing in BC, is that something you're seriously considering, and do you agree that it's needed?
Minister Farnworth and I have been talking about policing for some time. It wasn't just the advent of the frustrations and the challenges that we've seen south of the border. We have issues with law enforcement in Canada as well. We're not immune to this. On the broader question of racism, we've been working diligently by reestablishing the Human Rights Commission here in British Columbia, putting significant resources into anti-racism challenges. It's only appropriate, I think, during this time of questioning from the public that we take a look at the Police Act. It's 45 years old. What we expect law enforcement to do today is quite different from what they were doing 45 years ago. An understanding of mental health issues, an understanding of the consequences of addictions are just 2 that I think of off the top of my head. But the community policing needs of British Columbians are top of mind for us and for law enforcement, and a review of the Act is underway. I've asked Minister Farnworth to talk to his colleagues in the legislature, the critic for the opposition, as well as the Green Party, to see how we can get a committee going to get input from the public, from law enforcement professionals, as well as community leaders like Mayor Tate, so that we can shape the legislation for the 21st century rather than mid-century 2000 or 1900s.
Our next question is from Marcella Bernardo.
Here, I'm also going on.
Come to
I would love to, actually. I would love to. And thank you for taking my question. Mine's also a bit off topic. I was hoping to ask you about some of the confusion yesterday regarding the restaurant capacity now being changed from 50%. I've had some conversations with restaurant owners who are confused about whether or not the 50-person maximum limit is still applying. And would you have any insight into where things are at as far as trying to increase that 50-person limit so that people who are trying to plan music festivals or concerts or drive-in theater type things are able to do that possibly as early as July?
The 50-person maximum is a result of a public health order put in place by Dr. Henry. It's not just, as you rightly ask, Marcella, it's not just about restaurants. It's about a whole host of gatherings with large numbers of people. And we're looking to expand our restart going into phase 3 in the days ahead. I'm hopeful that next week we will have been through 2 incubation periods. We've had very positive results in parts of British Columbia, on the island, in the north, in the interior, with respect to no new outbreaks, no new cases. But Fraser Health and Vancouver Coastal continue to be showing signs of increasing caseloads, modest numbers to be sure, but we have had cases develop in Fraser Health, for example, because of a family gathering. And so we're very, very mindful of the need to be vigilant here, and Dr. Henry will be giving direction to not just restaurateurs, but others in the days ahead.
Our next question is from John Woodward.
Hey, thanks for taking this. So this is another one about the police. I wondered if you could tell me what your vision is for this revamping of the Police Act and what motivated that, and whether you're going to look at some of the things the Mayor of Vancouver pointed to yesterday, such as police accountability delays, street checks, redistributing resources from the police to other avenues to promote public safety.
Well, I can't comment on Mayor Kennedy's positions. I haven't seen his press conference. I do know he is the chair of the Vancouver Police Board, so is in a good position to implement changes himself. But on the broader question of the Police Act, which governs policing across the province, Minister Farnworth and I have had discussions about this for the past couple of weeks. And I believe yesterday he announced that he's going to be establishing through the legislature an all-party committee to review the Police Act. And my vision for that would be in this era of defunding the police. I think that's a simplistic approach to a complex problem. We need to increase funding for health services, whether it be mental health, addictions. We need to increase funding for housing so we can address homelessness issues. There's a range of other challenges that we have that we are now burdening law enforcement officers with. So when I hear people talking about defunding, I think that simplifies a very complex series of issues. We need to provide more resources to those challenging files. That's why we established a Minister of Mental Health and Addictions so that we could focus specifically during the opioid outbreak crisis on addressing addictions. We also have a whole host of mental health challenges that we need to focus our attentions on, and I think it's inappropriate to expect law enforcement to do that. And so my vision would include expanding the capacity for communities, whether they're responsible for their own policing or they contract the RCMP, to make sure that we're not asking more from law enforcement than they're prepared to or capable of delivering. That opens up a whole series of debates and discussions about how we provide more resources to community wellness that go out and beyond just community safety. So we've got a lot of work to do, but the exciting part of it is that the public is very much in the mood to have this discussion. And I believe that's the time when you act, and that's why Minister Farnworth took the steps he did yesterday.
Next, we have a question from Justin McElroy. Go ahead, Justin.
Hi, Premier. I was wondering if you have any comment on the Supreme Court of Canada ordering the BC government to pay the sole French language school board $6 million in damages for underfunding its school bus transportation for a decade.
I'm not aware of that ruling, Justin, so I can see if I can get back to you on that. I haven't been briefed on it, so I don't have a comment, but I'm happy to look into it for you, and I'll see to make sure Jen and I get back to you with a comment by the end of the day.
Next, we have a question from Sarah Exynos.
Hi, Grant. My question is also about the Supreme Court rules from this morning. I just want to have your reaction regarding of that.
Again, I have no reaction because I've been here in Sooke excited about the expansion of primary care delivery here. I'm not aware of the ruling. I'll have to get a briefing from the Attorney General, and we'll get someone perhaps to make a statement or someone available to the media later in the day.
Next, we have a question from Brendan Strain.
Hi, Premier. Thanks for taking my call. The commercial eviction ban is set to end on July 31st. There's a lot of businesses out there that have obviously been hurting through the pandemic. Is your government at all looking at expanding that ban going forward past July 31st?
Well, thanks for the question. And I know there's a great deal of anxiety in the community around COVID-19 and the consequences, not just the health consequences, but the economic and social consequences of what we've gone through as a community over the past 3 months. And these have been extremely challenging times. I also, if I'm looking to the end of July, in COVID years, that's 1,000 years from now. We're focusing on a daily basis on trying to ensure that we're giving space to businesses so that they can succeed, ensuring that the workforce is protected. I've been working very hard, for example, on establishing a national sick pay plan, and I'm very pleased that Prime Minister Trudeau recognizes the importance of that to ensure that people do not come to work because of an economic imperative when they're not well. I mean, I know that virtually everyone who's hearing my voice right now has gone to work when they've been sick, and we just can't do that in the current circumstances. And so those types of initiatives are front and center for me. The commercial eviction issue was one that we worked very hard with the federal government to clear up in the early days of their initial planning, and we'll continue to work in partnership with the federal government to protect businesses who would be evicted for no fault of their own other than the circumstances they find themselves in. And I would say to those who are renting space, if you've got a tenant right now, I don't know why you would want to remove them.
Next, we have a question from Richard Zisman.
Thanks for taking the question. Premier Horgan, one of the big pitches you had around Vancouver being a hub city was that families would be able to come and enjoy Vancouver as well. Dr. Henry made it clear yesterday that families are not part of the plan and the players would have to isolate away from their families. So does that hurt Vancouver's bid as a hub city? And is there something else you'd like to pitch now that that's not a possibility?
Well, I believe if I understand the question correctly, it's for that first 2-week isolation period. Families would be, as I understand it, was part of the initiative that the Canucks put before us, that families would travel with the players, but they would be required to self-isolate just as any other individuals coming into British Columbia. That remains the same. If I've misunderstood your question, Richard, I can get back to you later in the day, but my view is that Vancouver remains a desirable location for families to come for extended periods of time. That has always been part of when we discussed this with the Players Association, when we discussed it with Commissioner Bettman, it was with the view of a 6 to 8 week or longer period where players will be in one location, and it's unreasonable to expect them to be distant from their families for that period of time. And I think if any hub city is going to have to be able to provide accommodation and space in the lives of the players for their families, that's a reasonable expectation, it seems to me.
We only have time for one more question today, and it's from Andrew McLeod.
Yeah, hi, Premier. Back to primary care. When your government came to office, there was something like 700,000 British Columbia who didn't have attachment to a doctor or a clinic. Part of the story is certain corporations have moved to the space, mostly providing sort of episodic care, like the one-off. You talked about the model you're talking about today as being sort of the ideal. So I'm wondering, overall, province What are you doing to encourage and support more of the kind of care you're announcing today and less of the other kinds of care?
Andrew, can I ask you to rephrase that and try one more time? You cut out a little bit, and I think I lost the thread.
Yeah, mostly I'm asking why you are, what exactly the government is doing to encourage more of the kind of attached longitudinal care that you today in Sooke, and the context is a large number of people in British Columbia who don't have attachment family dogs, and the other models that are out of, there's certain corporations moving into the space, providing sort of episodic, very quick, low-hanging fruit type care, and there seems to be less to provide that sort of continuity of care that you're talking about today. So what is the province doing to encourage more of that?
Okay, I get you now. Well, firstly, let's go back to the episodic care. I think the urgent primary care model has been very well suited for large urban centers where you have acute care facilities that oftentimes have crowded emergency rooms because of unattached patients. Having the urgent primary care centers allows practitioners to be outside of the acute care model and providing the services that individuals will need on a case-by-case basis. The model here in Sooke is having a series of attached patients with the opportunity to have clinic or walk-in type care. And so what I would like to see is Sooke be the model for communities of this size, 14 to 15,000 people. I think of places like Quesnel, Williams Lake, maybe even Cranbrook, where you can take the hybrid model that we have here and see if we can implement that across the province until we see a time in the future, and I'm not speculating on when that would be, where we have an abundance or a surplus of general practitioners. I don't see that happening anytime soon. So how do we stretch the resources we have to meet the greatest number of people's needs? And I believe the model in Sooke is an ideal one, and we're going to take the success here and try and duplicate it in other communities. I think on the fee-for-service side, the success and Dr. Saunders' experience as a leader within the in the delivery of care within the Lower Island allows us to take the model here and shop it around to other communities. And when we've had a level of success that I know we're going to have here, I think it'll be an easy sell.
Thank you, everyone. That's all the time we have today.
Thanks, everyone.